Welcome to page 30 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The glenohumeral joint, otherwise known as the shoulder joint. This is what you typically think of when you think shoulder joint. There are two other joints, the sternoclavicular down here and the acromioclavicular, but the glenohumeral joint is specifically discussed here. It is a synovial joint, freely moving, ball and socket type, and it provides a tremendous amount of range of motion for the upper limb. Let's go over some structures here that we're already familiar with. The Acromion Process, you recall, coming off of the spine of the scapula. You can see it right here. Right here. And here. And here. And here. This is not particularly part of the acromio or of the glenohumeral joint. But just a review of structures, of course, the coronoid or the coracoid process, excuse me, of the scapula. Coracoid process. And, of course, the glenoid fossa. The glenoid fossa here. Glenoid fossa of the scapula. And here it is again, the glenoid fossa of the scapula. Of course, up here, coracoid, acromion, and of course that's why it is called the glenohumeral joint. The glenoid fossa, as well as the head of the humerus, have a very thin layer of hyaline cartilage, or a very slippery thin layer of hyaline cartilage, so that when they connect, there's very little, and over here too, very little friction. The idea behind these joints is we want to be as friction free as possible. This articular cartilage, a very thin layer over the top of the head. And the glenoid has a surrounding it, because the glenoid fossa is actually very shallow, quite shallow. It's a concave, but it is still shallow, and yet it has to accept the humeral head. And so coming off of the humeral head, there is what is called a labrum, a glenoid labrum, which is also cartilage, a fibrocartilaginous glenoid labrum right here. It's sort of a lip, similar to the femoral joint. The iliofemoral joint, where it creates a slightly greater room, or let's see, how can we say this? Here it is right here. It creates greater surface area, you might say, for the right here, for the head of the head of the humerus to attach to. It sort of wraps around the humeral head a little better, making it a little more snug. So we see it here here. And it sort of wraps around in a circular fashion. The glenoid fossa, of course, is right behind it. Glenoid fossa is here, very shallow. And you can see how the labrum deepens the joint ever so slightly. Glenoid labrum. Now, surrounding the joint is a joint capsule. A joint capsule, keeping the joint nice and snug and tight, and also keeping the synovial fluid inside and keeping it sort of airtight and pressurized in there. The joint capsule. And here we have another look of the joint capsule surrounding the shoulder joint. This layer in here. Actually, inside the layer, inside the synovial membrane, inside the joint capsule is a very thin layer called the synovial membrane. This is the membrane that releases the synovial fluid. There are bursa, or sacs, containing fluid called bursa or bursae. Here's one right here called the subdeltoid bursa and the subacromial bursa. Contiguous, one and the same. This part of it is underneath the acromion process. And what these sacs of fluid do, they protect against friction. Too much friction in the joint. Here's a subscapular bursa here. Sacs of synovial fluid that protect against friction. You can imagine when an individual raises their arm, there could be an impingement underneath the arm, and this subacromial bursa and subdeltoid bursa looks to be protective against that pinching. Also, the deltoid muscle runs right over the top here, like so, and you can see how that bursa would play a protective role in eliminating friction. Bursae, or the bursa of the shoulder. We talked about the synovial membrane lining the inside of the joint capsule. Let's point out that joint capsule again from this different view here. Joint capsule right here is this layer of tissue. And above it, you can see the subacromial and subdeltoid bursa. Here's the subacromial bursa, providing that valuable sort of cushion. And then the subdeltoid bursa, one contiguous piece. You can see sub means underneath the acromion, and underneath the deltoid muscle, protecting and cushioning from friction of that muscle from the motion and the gliding motions, helping the gliding motion of the structures underneath, of the movement of the shoulder underneath. Interestingly about the shoulder joint is the tendon of the biceps brachii muscle, the long head of the biceps brachii here inserts, or originates, I should say, on the supraglenoid tubercle, this area right here. Inserts this tendon. Mind you, this is a tendon, this is your bicep muscle. A tendon from your bicep muscle, which is on the front of the arm. And it's the large muscle that you see, you know, you go and you work your biceps, a big lump on the front of the arm. But interesting that it comes all the way up. It originates all the way in the shoulder, and it actually comes through, and this is the tendon, and pierces through the joint capsule of the shoulder and is surrounded by synovial membrane, that slippery synovial membrane that lines the inside of the joint capsule. And there's an extra portion of it that surrounds the biceps tendon muscle as it heads, the biceps tendon as it heads inferiorly, or as it passes through the intertubercular groove right here. You can imagine this tendon sliding and stretching up and down through the shoulder as it's working and operating. Very complex structure. Of course, inside here is the synovial cavity with the synovial fluid. And the synovial membrane, here it is, continuing off of the head of the humerus and then attaching to the scapula. But this sort of airtight, pressurized place with slippery synovial fluid and slippery synovial membrane, and then hyaline cartilage on the head of the humerus and on the glenoid fossa as well, creates for a very mobile, friction-free environment, along with the subacromial and subdeltoid bursae. And here we see the inner lining, of course, of the joint capsule, the synovial membrane here. And this outcropping of synovial membrane off of the joint capsule to sort of provide a sheath for the biceps tendon to pass right through the capsule. So here's the intertubercular groove here, and the biceps tendon would be piercing through this capsule to get inside the joint and being enveloped, as I said, by the synovial membrane. And above here, finally, we see the ligaments outside on top of the capsular ligaments coming across the glenohumeral ligaments, or the coraco from the coracoid process to the humerus, and the glenohumeral ligaments. These ligaments actually make up the joint capsule. The glenohumeral ligaments, the coracohumeral in blue, and then the glenohumeral ligaments in light blue, with the bursa, subscapular bursa, running over the top. And here we can see, of course, the biceps tendon coming from piercing the capsule, and the wrapping of the synovial membrane right here, piercing the joint capsule, piercing the glenohumeral ligaments. And of course, attaching up here at the supraglenoid tubercle right in here. And here's another look from the lateral side of the bursa, the subacromial and subdeltoid bursa. The ligaments, the glenohumeral ligaments, which are thickened portions of the capsule and the capsule itself contiguous with the ligaments. Ligaments, we got capsule, and then ligaments, which are just thickened portions of the capsule running along the outside. The anterior portion is particularly protected with thickened ligaments to avoid dislocation or anterior movement of the humerus and preventing from slipping out of the glenoid fossa. And this is the end of the page 30 of Anatomy Coloring Book. This is Dr. Stephen Harkins.